Thank you for hitting play, and welcome to the series we're calling Data Pioneers. We're bringing together the brightest minds in the healthcare industry, supporting the transition to value-based care. We'll be highlighting the best practices, tools, lessons, and advice with a focus on data and analytics. I'm your host, Rich Waller from WellStack, and we're very excited to have you join us today. Gabrielle, welcome to Data Pioneers. We're excited to have you on today.
Thanks for having me.
Awesome. So before we jump in, just by way of background, can you give us a little bit of an intro on yourself, your background in the healthcare industry, and then a little bit about your current role in WCHQ?
Sure. So I'm Gabrielle Rude. I am president and CEO of the Wisconsin Collaborative for Healthcare Quality, or WCHQ. By background, I'm a native Wisconsinite. So I grew up here, got my undergraduate degree in central Wisconsin. I've long had an interest in health, so my undergrad degree was in health promotion wellness, but I also double majored in Spanish, which really set the trajectory for where I am today, working with some vulnerable populations. I ended up getting a PhD in population health sciences from UW-Madison because of my interest in working with immigrant populations. And following that, I decided I wanted to go out and learn about industry. So I have more than 10 years of experience working directly in a health system, as well as for health plans and a few other partners, working on care delivery, optimizing that for patients and populations. And then my current organization, WCHQ, we are a regional health improvement collaborative. We work to bring information about populations to care providers, as well as to help them share with each other what are their best practices, what can they work on. So leveraging that data so that they can actually have a maximum impact.
That's fantastic, and it's always such a pleasure to connect with you. I always learn so much because you guys are doing such an amazing work at WCHQ, and we always, as always, kind of on this series, we're really focusing on what is data's role in the healthcare industry as we move forward, transitioning to value-based care, and all the different dynamics that are involved in that. And so, as we jump in here, what would you say has been most surprising about your journey in kind of leveraging data and all the things that you're working on today?
I would say most surprising, at least recently, I thought we would have more progress as an industry than we have currently with unleashing this data. I think a lot of people did. I mean, I remember the first time I rolled out a medical record in a health system, I got requests for reports the very next day. And it has somewhat surprised me that we haven't solved that problem nationally. It is part of what makes me so proud of being part of Wisconsin and the resource and partnership we have here, because we actually have a solution. But my organization still stands alone as being really unique and the only regional health improvement collaborative in the nation that has this kind of data that we can share with providers. I think, 15 years ago when we were rolling out EMRs, we all expected, and even our smaller clinics, we all expected that this somehow would magically be working. It's a good opportunity for my organization because we solve a good problem, but I just thought we would be further along in our journey of unleashing data for people to use. So it's surprising that we're there, but it is still an opportunity for organizations like mine to think about how we can provide that service.
Yeah, absolutely. And at WCHQ, you all are doing some really exciting work around topics such as health disparities and value acceleration. And let's start with health disparities. Tell us a little bit about this work, some of the I would say the wins, and then also some of the challenges that you've had in producing such important insights.
Yeah, so health disparities, health equity, it's the ubiquitous term. Everybody wants to use it. Everybody wants to do something about it. So it's really important. I started my whole career, even before health disparities was a popular topic. That's what I cared about, was figuring out how vulnerable populations could access healthcare. It's exciting that everyone wants to talk about it. Everybody wants it to be a priority. But I think the biggest challenge that people experience as they're trying to address it is having actionable information. So if you have information that says there's a disparity, but it's not granular enough, you're not going to be able to design the right solution for that population. You also need to have a lot of context for that solution. So our work at WCHQ has been being able to look at specific populations really granularly. So where do people live? What are their risk factors for this disease? Because those are markers for the help that they might need. we can get down to the actual patient address that people are at versus just thinking about what state they live in. And that's really important to designing a solution. And we know we need to bring in a lot of context. So what resources are in their region? How close are they to healthcare providers? Are they living near a grocery store? I think that's the challenge that we've all experienced. We have a leg up here in Wisconsin, but it is a challenge to have both granular information as well as context, because without both, you aren't going to have the partners, the resources, and the right solutions to put in place. So I think that's a challenge that we have done a good job of figuring out. The work that we've done, we're really excited about some of the results we're starting to see. So just pre-pandemic, our work in disparities really took off here in Wisconsin. We had brought together health system leaders who all said it's a priority. Every single health system in the state said this is a top priority for them. And while we want to design solutions for the people and the patients that they serve, we also want to find commonalities so that they can learn from each other and work together on these. So just pre-pandemic, we had a summit and we picked a few priority areas that our whole state wanted to work on. During the pandemic, those disparities that we were looking at started to get worse. So the very people that were most vulnerable pre-pandemic had the hardest time accessing healthcare, and we started to see a worsening of some of those disparities. But our work of taking data, and we like to say we shine a light on the opportunities. So rather than just trying to figure out guessing where you should put your resources, we shine a light. This is where your problem is for your patient population, which is maybe different from the provider right down the road. So this is where your problem is. And then taking that information and connecting it with, well, what works? Because we have had some success in organizations that have achieved reduction in disparities in
Mm-hmm.
Wisconsin and elsewhere. So our job is to bring that information forward. We are about to actually, within the next month, release a report on what we're seeing on our top priorities through the pandemic. So we had looked at colorectal cancer, blood pressure control, and diabetes. Those were the priorities that health systems said they cared about and wanted to address. We're starting to see those populations, particularly the disparities, go back to pre-pandemic levels. And we have a few examples of successfully closing those gaps.
Mm.
And we know it's because of this combination of having the right data and then partnering with others to share that data so that you're not reinventing the wheel every time. So our reports will be out. We've put out a lot of reports on disparities that say where they are. This will be the first time we're actually going to say, and we've done something about it. So we hope others can learn from this and be able to start replicating this work elsewhere. But we've just started, picked a few populations, a few clinical conditions, and it is painstaking work to have the right information combined with the strategy. But we're very optimistic about what we're seeing because everyone's focused on it and committed to sharing.
Yeah, and it's, correct me if I'm wrong, you have approximately, is it 5 million ish kind of patients or lives, 4 or 5 million? Is that right in terms of the total data set that you have available?
Right. So that's where we have this really unique asset of data. It's a huge amount of data. Not only is it 5 million, but it's more than 10 years of data.
Mm-hmm.
So we're able to look at patients over time as they transition through care, change providers, all of that. But it's a huge repository of data that we can ask questions of. And, you know, our research into disparities, we learned things we hadn't thought about. We first started our disparities work and we were thinking, there's definitely a difference between people that live in rural Wisconsin versus urban. We
Right.
assumed that. What we didn't know until we actually looked at the data, that there are some significant differences between rural populations, that one rural population that lives very close to a health system or is much more affluent or has a different demographic makeup, they have totally different health needs than others. So we actually were able to go back to the data and start looking at it in more narrow segments. We couldn't do that without having patient level data. Similarly, we were thinking that zip code would be sufficient because where you live in your zip code is a great marker. But you have some of our more urban zip codes, and you can have extremely different populations with different needs. And our work is, well, what strategy should we deploy? And if you don't know the differences between these populations, you're going to provide the wrong strategy. So we've
Yeah.
learned a lot in this sort of iterative process we've been able to use, but it's all hinging on the fact that we have this huge quantity of patients. I mean, it's the majority of our state and some of our region, as well as that we have it over time. So we're not just looking at this point in time, which the pandemic's a great example of that. If you just look at what happened during the pandemic on diabetes, you have the wrong message about where that population is trending. And so our ability to look across more than 10 years of data, it really helps us to know where should we focus our resources and is it working, so we can go back later and look and see if it actually worked.
Right. Yeah, that's really great. And kind of given that, I would say affordability is obviously in healthcare is top of mind. Let's talk a little bit about kind of the wins or exciting opportunities you see within your work around value acceleration.
We are really excited about our value acceleration work. So, value is a huge topic nationwide, and it connects with health disparities because if you can't afford care, you can't get the outcomes that you want. So, our value work is very tied to our disparities work. We want to make sure that all patients have the opportunity to get the right care. The conversation about value nationally, we think, has been about a shorter time period than improvement actually happens. So
Hmm.
patients don't just get care and don't just have improvements in one claims year. They have lifetimes, and interventions, medical interventions, don't just happen in one claims year. That is difficult from a cost perspective. We know that in a industry where employers are paying for claims in 1 year and their employee might leave to go to another
Hmm.
employer, that's really difficult to put a
Yeah.
big investment in place. So we know we're part of that context. That said, we think that investing in the right strategies and making sure patients avoid complications or have better outcomes long term, that's what's going to save our nation money in terms of healthcare. So our focus and value has been on long-term outcomes, and that's not necessarily 10, 20 years. It could be at least just a couple years. But how does the medication that we prescribe today impact a patient's outcome next year? So our data, we can follow a patient and look for trends. We can also follow a provider's practice or a system practice and think about what interventions are they putting in place and how is that having an impact on that population. So if it's working, you can keep doing it. And if it's not, we can learn from that. But you need data at a population level to really evaluate that, and you need it over time. So our value work, some of which we have published, and some of which at this point we're providing just directly to our members
Hmm.
because it is so different from what's happening in a lot of the other conversations. We want to get it right before we put out a big report. But we've been able to take our data and look at all of our member health systems and compare what are your interventions you have in place for this population. We're currently really focused on diabetes. It's extremely expensive and very prevalent. So for your diabetic population, what interventions does this health system have in place compared to another? And how does that compare in their outcomes? We've been able to identify trends in what are the primary causes of these differences between health systems. And then we're able to think about, well, what could you put in place that could address that? So some of our early results show that the health systems that are most engaged in quality improvement activities have the best outcomes. That seems obvious. But during a pandemic, when resources have been really short and health systems are making tough decisions, they need that data to tell them it's the right thing to do. It can't just be a feel good decision like, oh, I know it's right to care about patients' quality. No, I actually know if we put this intervention in place, we'll have better outcomes. And long term, those outcomes will reduce costs. So looking at avoiding complications, looking at avoiding readmissions, avoiding amputations, all of these things that cost a lot of money, by looking at it long term, we're actually making the case that these interventions will save money, even though in one claims year they look expensive. If you can look over 2, 3, 10 years, which we have
Yeah,
the capability of doing, you're saving money. So we're
absolutely.
excited about that. But I think our next step is going to be figuring out how to share that more publicly, so that payers and purchasers also can use that. But right now, health systems are using that to actually make changes in their practice so that they can learn from each other and avoid costs.
Right. That's amazing. And it's really great to see, kind of that, payer provider collaboration starting to, I would say evolve more. And I know there's a lot of, kind of Wisconsin has a unique payer landscape in that regard, and that there's a lot of, system owned health plans that are naturally collaborating and things like that. So it's a really, amazing, I think, state, as you had mentioned. And I think that it's fortunate to have, that type of a data set available, to be able to drive a lot of these things forward. So it's really, really pretty cool to see. I also noticed that WCHQ has, what I believe is the nation's first regional collaborative around oral health, right? Tell us a little bit about that, maybe how it started and some of the outcomes of that program.
Great question. So I appreciate that you call it oral health because that's actually something we've had to learn is the right term. Our knowledge of oral health as a collaborative was pretty limited when we were actually approached by some oral health providers. They had been at some events we had, they heard some of our presentations and came to us with this idea and said, we would like to be a part of your collaborative. Our knowledge of oral health and the fact that that's the right term to call it versus just dental care, I would say is a real parallel to the medical industry as a whole and their understanding of the connection and the importance of connecting with dentists and the care
Mm.
that they can provide. One of our members likes to joke that it's because medical providers, their training stops at the throat. There's something in front of the throat, but that's not where they look in medicine. But that metaphor is really real, that these oral health providers came to us and said, we want to be a part of your collaborative because we want to bring data together with medical providers. And since we started several years ago, we definitely have built expertise and brought in experts, including our ability to collect data. So we are collecting patient level data from dental providers with two goals. One, to help these oral health providers move into quality measurement. The
Mm.
dental industry as a whole is currently paid primarily on procedures. So, did you perform a procedure? So, the ability to measure quality and the ability to publicly report it is pretty revolutionary, but will help them to move the direction that medicine has so they can measure it. Second, we want to match that data up with the medical data because there is such an overlap between disease processes, and dentists can actually see inflammation, diabetes, much more goes on in the oral space, and that information is valuable to medical providers. It also can connect back then with value, reducing costs if we can avoid emergency department utilization. Dental pain is a huge ED
Mm.
utilizer.
Yeah.
But our goal is to actually, at the patient level, match patients that are seen by dentists with medical providers so that they can collaborate on care as well as look at population trends so that, like all of our work, they can figure out what works and start spreading that between these two industries that really have a lot of overlap at the patient level.
Absolutely, that's really cool. And in addition to that, I mean, as we obviously work with you all pretty closely, the kind of the focus areas and task force, and just reading a few of them, you work with antibiotic stewardship, asthma, behavioral health, CKD, cancer screening, maternal health, many others, right? I mean, where it seems like just a lot of work that you all are taking on. What are some of the highlights or areas that you're excited about in this coming year around some of those specific areas of focus?
Right. So we do have a lot of focus areas. That's on purpose because no health system has the same population and the same needs. So we design our work to try and meet all of them where their opportunities are. And not every health system participates in everything we do, although some do. But that's why we have so many. There's just different needs in different populations. And it is a lot of work that's going on. Of all of that work, I'm excited about all of that work. I would say a couple areas that we think about that we're highlighting in our behavioral health space, a really critical need that has emerged in particular through the pandemic as mental health awareness, but needs increased. We have been a pioneer in reporting data, starting with depression screening. So we started about 8 years ago, publicly reporting depression screening rates. That's a process metric. So we were interested in, are you even screening it? When we started, about 40% of patients were screened annually for depression screening. Today in our population, more than 80%. So a huge increase. But more importantly is where we're going next with that population. So next, we're actually going to be able to look at outcomes. So a patient screens positive for having depression. Ideally, you would like that patient to have reduction in their symptoms through treatment. And that's where the magic of our data comes in because we're able to look at not just did the test happen, but what was the result? And then tracking it over time based on an intervention. So if they started therapy or a medication, are we seeing a reduction in symptoms? We're really excited about being able to talk about that because we don't just want patients screened, we want the outcomes. So we're really excited about that work. And I think that will be a leader for the nation in thinking about how do you address a condition when there are a shortage of providers, the number of patients increasing, but we're going to be able to use the data to really pinpoint our strategies. So I know we're going to see improvement in Wisconsin and be a leader there, leveraging that data and the collaboration. Another area to highlight that we're excited about is our maternal health work. Wisconsin has some significant disparities in maternal morbidity and mortality. So we have been a leader in working on that in Wisconsin, trying to address this critical problem. But our organization's role has been to move really far upstream. Because of the data we have on so many patients, we can actually look at patients before they get to the hospital, which a lot of the focus is on that. And that's where the bad outcome happens. But it starts a lot sooner. So our ability to follow a patient through prenatal care, or maybe even not getting prenatal care and find that patient, we want to focus our target earlier than when they come to the hospital. We've been working on this topic for about 18 months and are just about to put out some reports that really tell us, but we have already learned that there is a lot of information that tells you whether a mother's going to have a bad outcome or a
Mm.
likely bad outcome. And it's happening primarily in the outpatient space. So we're excited that we might be able to actually intervene on what we think is a pretty significant crisis in Wisconsin for certain populations, with our goal being that all moms and all babies should have great outcomes at birth. So soon we'll be putting out a report talking about that, as well as some effective strategies that health systems have put in place to address this. But what it's going to do is take the crisis of what's happening in the hospital and turn it into an intervention you can put in place before the mother is even in her third trimester. So ideally, we'll get all moms into the needed prenatal care and then follow them through a successful delivery, and then continue following them through to make sure they're getting postnatal care, which needs to be a part of that whole package. But that's the magic of having this longitudinal data on so many patients.
Wow. Yeah, those seem like really exciting initiatives. And when you think back on kind of when you first started this journey, certainly I'm sure a lot of lessons learned and battle scars along the way. For those that are out there that are listening, kind of just starting on this journey, right, of kind of trying to either assemble a large data set or leverage data for similar types of use cases, what advice would you have for them? What guidance would you have for those that are maybe kind of just in the beginning of that journey?
The most important thing, I think, an individual or organization that wants to unleash their data or leverage a repository of data, the most important thing I think they should do is make sure all of the decision makers that are going to sign off on the strategy you choose have a very clear understanding of the end you have in mind and how that's different from the tools and technology you might use to optimize patient care. So we hear this a lot. I heard this when I was in a health system. It's in the medical record. Can't you just write me a report? And that answer is much more complex than just write a report. In my experience, when I was in a health system, yeah, we could run a report, but we were very quickly inundated with the number of reports and couldn't keep up, even in a very sophisticated health system. Second, it wasn't just a report. The people that need the reports to make decisions about populations, they need granular information about those patients, but they need context to understand it. And it's not just a report. So your solution that you pick, if your end goal is really to understand population, have an impact, your solution needs to be focused on bringing together context and granular data. And your decision makers might think, well, I just invested in this really elaborate tool. Why can't it do both things? So it's really important that all of the decision makers have the end in mind. What are we trying to do with this data? How's that different from a care team? Because you don't want your care team to optimize their process for a report, and you don't want your report to be limited by what a care team is trying to accomplish. They're two different and really, really important things that definitely interact. But the decisions you make about who to partner with, what resources you need, you have to make sure all those decision makers really understand the complexity of bringing together that much data and the differences between the decision to work with your internal team versus a partner. I'm not advocating for either one, but I have seen over and over again our partners talking about data and the use of data as if it's an all-encompassing one thing. It's not. There's a lot of different ways you could choose to interact with data, but if you're very clear about what you're trying to accomplish and recognizing that that's a distinct feature compared to optimizing your care delivery, then you can get your team behind what is the partner, what are the resources we need. I would say my biggest advice is make sure you have that very clear upfront, so that you don't have an argument down the road when one group has a preference for a solution and the other one is not understanding why that solution's superior.
Mhm.
That decision up front also will help you to figure out who you need to talk to and what strategies are even available to you. So start with the end in mind, and then make sure all your decision makers understand why that is important.
Excellent. What are some of the biggest headwinds you see for the in the industry, or for your organization? What are you kind of keeping an eye on in terms of some challenges that are coming up?
For our industry, which is an industry of organizations that are bringing data together from lots of health systems, one headwind we have is some of our health systems are getting very large and want to be thoughtful about who they partner with, and are questioning, well, why would I need to compare with another system? Why would I need this? So for our industry specifically, it's a question I get a lot. We have great data to show them that comparison with other systems actually helps you improve faster. And in fact, there is no one really large health system that is going to be the top performer on every quality measure you find.
Mm.
So you're going to be missing out on learning and collaboration. Furthermore, the patients you serve, they are going to go between these health systems. So partnering, sharing information, and being a part of the ability to share data together is really important for the patient. So that's a headwind we have to go against. For us, it's an opportunity to really show data and let it tell the story, because we can point to a small regional clinic that's done something really well. We can point to a community health center that has a service that this very large system doesn't have. There's no magic size system that can do everything really well. So definitely a challenge to make those stories as health systems consolidate, and then in some cases unconsolidate later. Certainly also as an industry, it's no surprise, we're still seeing the reverberations of COVID and the financial impacts to our health systems. I think that overall we're starting to move in positive directions, but there's been a delayed impact of some of those financial implications, and it makes organizations have to think carefully about where they spend their resources. I again think, though, the data can tell the story. And if organizations really want to not just survive this year and want to think about how do I help my population have better outcomes at lower costs long term, then partnering on bringing data together from lots of sources is a very easy business case to make. But we have to have those conversations about, why are we doing this? Why is it long term versus this year? And how can we help you get there? The data tells the story. So that's the positive, is we have the data tells the story. But it is a challenging time with these headwinds hitting us.
Yeah, absolutely. And we look to really, I would say, foster a pretty collaborative, knowledge sharing forum here. And so, what are some of your sources of intelligence? So, like news, podcast, publications, industry organizations. Where do you go for industry information, or just in general for moving the needle with data?
I have a lot of sources that I go to. So at the nationwide level, we're fortunate that organizations like mine are part of a membership organization called Civitas, who actually today has our monthly member news meeting where they share best practices. So organizations like ours belonging to a membership organization, I can't read every publication that there is. I certainly read all of the National Business Journal's health news. I read all of those. I really love, Wisconsin has a great resource called Wisconsin Health News. I don't know if other states actually have this, but we have essentially a one-man band organization in our state that collates a lot of resources for us, and that's my favorite source. I actually get a twice daily update from
Nice.
Wisconsin Health News, and they facilitate in-person meetings, et cetera. But it's constantly evolving for me. This will certainly be my new favorite podcast going forward.
Well,
But
naturally, of course, yeah.
but it's always evolving, and I would say I get most of my information from talking to our member health systems face to face. There has been no better source for what's going on, what do I need to be paying attention to, than talking to health systems, because whether it's in the news or not, I need to know what's going on in their community, and that is going to be more immediate and relevant to me than anything else. So I actually spend more time talking to health system leaders and their staff about what's going on in your specific location, and then I spend a lot of time on my weekends reading publications and trying to keep up on what other people are saying about that.
That's amazing. Well, really great. It's been awesome having you on. I really enjoyed this conversation. I think that we, covered some really great topics. And, again, thank you so much for your time. And it's always such a pleasure.
Likewise. Thanks for having me. Look
Thank you.
forward to talking again.